So the Affordable Care Act, or Obamacare, getting a hit in the stomach with the announcement UnitedHealthcare is dropping out of the exchanges, the biggest carrier there is. That is not a good signal for the survival of the Affordable Care Act. Let's go back and take a look at where we were before Obamacare was passed. 85% of the people had insurance. 65% of those people said they liked their insurance. So the rest of the people had either rotten insurance or no insurance. So you had 15% of the population totally uncovered. You had people who had high-risk conditions, breast cancer survivors, prostate cancer survivors, who couldn't afford to buy the high-risk pool insurance. Wisconsin had one of the better plans, HRSP, but I'm told that was very, very high. So what do we do now? If we start getting carriers that will just drop out of the exchanges, which means they won't participate in the subsidies, just relying on the private market, Obamacare will collapse. It may not happen. But the fact of the matter is most Americans are on board with the concept of covering people with pre-existing conditions. It's a major shift forward. People support subsidizing patients that are high risk. Even Paul Ryan, the conservative Republican Speaker of the House, wanted to do that. He wanted to subsidize people who are high risk in a pool so that their own contributions were commensurate with the market. Then you could bring market forces in to take care of people that are healthy and have some money while subsidizing people that need help. They could figure something out. But the fact of the matter is, even before we did the AFC, the Affordable Care Act, dentists, find a dentist who would take a Medicaid patient, huh? Not going to happen. The reimbursement level for doctors, for hospitals on Medicare and Medicaid is diminishing in percentage. They're not going to do it. They're going to retire, get out of it. We haven't even faced the reality of the situation. But this is a dangerous signal. We should all sit up and pay attention and embrace the need to subsidize the people who need to be subsidized. My 2 cents, my 2 minutes are brought to you by Edge Construction and Capital Consultants. Bill McCoshen, a lobbyist who worked for Tommy, who gets things done downtown. We can talk about this and more on the radio on Monday at 8 o'clock on 92.1 FM The Mic, The Mitch Henck Show. Talk to you then.